Waking up with a headache can feel unfair, like you did nothing wrong and you still start the day behind. The good news is, morning headaches often follow a few repeat patterns, and once you know the pattern, you can test small changes and see what actually helps you. In this video, we'll walk through the most common reasons people wake up with head pain, from dehydration and sleep posture to breathing issues and teeth grinding. We'll also talk about what the timing of the pain can suggest, like headaches that hit the second you open your eyes versus ones that build over an hour. I'll keep it practical and realistic. No miracle fixes, just the most likely causes, what to look for, and low-risk steps that many people find helpful. And I'll flag situations where it's smart to get checked, because some causes are easy to miss on your own. Let's start with the simplest one that surprises a lot of people. Moving to slide 2. One of the most common and most fixable triggers is dehydration. You go 7 or 8 hours without drinking, and if you started the night a bit low, you can wake up with a dull, tight headache. Alcohol makes this more likely, but so can salty dinners, heavy sweating, or just not drinking enough during the day. The dehydration-type headache often feels like pressure across the forehead or a general tight head feeling. You might also notice dry mouth, darker urine, or feeling a little lightheaded when you stand up. What may help is boring but effective. Drink more earlier in the day and have a small glass of water available when you wake up. If you wake up to pee a lot, don't force extra water at night. Shift it to the afternoon instead. And if alcohol is involved, alternating water with drinks and eating with alcohol can reduce the overnight fluid shift that contributes to morning pain. Moving to slide 3. Next is caffeine. Either too much, too late, or not enough compared to your usual. If you regularly have coffee or energy drinks and then sleep in, your brain may interpret that delay as withdrawal. That can create a morning headache that improves after caffeine. On the flip side, having caffeine late in the day can fragment sleep. You might still get enough hours, but the quality drops, and you wake up with a headache and a not restored feeling. A simple way to test this is to keep caffeine consistent for a week. Same amount, same timing. Many people do well with caffeine earlier than a cutoff about 8 hours before bedtime, but sensitivity varies. Also watch hidden sources like pre-workout, strong tea, and chocolate. The goal isn't perfection. It's to see whether your morning headaches track with caffeine timing and consistency. Moving to slide 4. Another big bucket is sleep quality and sleep debt. If you're not getting enough deep sleep, your pain system can become more sensitive. That can make you wake up with a headache even if nothing else changed. Irregular schedules are a common culprit. Weekday short sleep, weekend catch-up, and your body never settles into a rhythm. Some people also get headaches from sleeping too long, especially if they stay in bed after waking and drift in and out of light sleep. What may help here is building a steadier sleep window. Aim for a consistent wake time most days, then adjust bedtime to match. If you need more sleep, add it gradually, like 15 to 30 minutes earlier every few nights. And if you wake up and you're clearly awake, getting up can be better than lingering for an extra hour of broken sleep. This is about stability, not strict rules. Moving to slide 5. Your neck and jaw position overnight can also set you up for a morning headache. If you wake with pain at the base of the skull, behind the eyes, or with a stiff neck, muscle tension is a strong suspect. A pillow that's too high or too flat can keep your neck rotated or bent for hours. Stomach sleeping often twists the neck, and some people clench their jaw without realizing it. What may help is neutral alignment. Side sleepers often do best when the pillow fills the space between shoulder and head. Back sleepers may need a lower pillow that supports the curve of the neck. If you wake with jaw soreness or tooth sensitivity, that points more toward clenching or grinding. Gentle jaw relaxation before bed and discussing a night guard with a dentist are common next steps. The key is matching the fix to the pattern of pain you wake with. Moving to slide 6. A major cause people overlook is breathing during sleep. If you snore loudly, wake up with a dry mouth, or feel unrefreshed despite enough hours, it may be a sign of sleep-disordered breathing. The most well-known form is obstructive sleep apnea, where the airway narrows and breathing repeatedly pauses or becomes shallow. That can lead to morning headaches. often from changes in oxygen and carbon dioxide levels and from fragmented sleep. Not everyone with sleep apnea fits a stereotype, so it's worth taking symptoms seriously. What may help starts with awareness. Ask a partner about snoring or pauses, or use an audio recording to check patterns. Side sleeping can reduce snoring for some people. Nasal congestion management can also matter. But the most important step, if signs point that way, is discussing a sleep evaluation with a clinician, because proper diagnosis changes the options. Moving to slide 7. Let's talk about teeth grinding and clenching, also called bruxism. This can happen during sleep even if you never notice it. The classic clues are jaw tightness, temple pain, headaches that feel like a band around the head, and sometimes clicking or soreness near the jaw joint. Stress can increase it, but it's not only stress. Bite alignment, sleep quality, and even certain stimulants can play a role. What may help is reducing the load on the jaw at night. Avoid chewing gum in the evening, and be cautious with very chewy foods late. A short wind-down routine that relaxes the jaw, like letting the tongue rest on the roof of the mouth and keeping teeth slightly apart, can be a useful cue. If symptoms are frequent, a dentist can check for wear patterns and discuss protective options like a custom night guard. The goal is to reduce strain, not to force the jaw into place. Moving to slide 8. Sinus and nasal issues can also cause morning headaches, but they're often misunderstood. True sinus-related headache usually comes with nasal congestion, facial pressure, and sometimes thick drainage. Many headaches people call sinus are actually migraines or tension-type headaches. Still, if you wake with pressure in the cheeks or forehead and you're congested, breathing through your nose all night may have been harder. Dry air can irritate nasal passages too, especially in colder seasons or with indoor heating. What may help depends on the cause. Simple steps include keeping the bedroom air comfortably humid, addressing allergies, and using saline rinses if they agree with you. If you have fever, severe facial pain, or symptoms that persist, it's worth getting evaluated to rule out infection or other issues. The key is matching pressure with real nasal symptoms, not just assuming it's sinus every time. Moving to slide 9. Blood sugar swings are another morning headache trigger, especially if dinner was early, very light, or very high in refined carbs. Overnight, your body is still using energy, and some people are more sensitive to dips or rapid changes. You might wake up with a headache, plus shakiness, nausea, or feeling wired but tired. This is more common in people with diabetes, but it can happen without it too. What may help is experimenting with dinner composition. A meal with protein, fiber, and healthy fats tends to keep blood sugar steadier than a carb-heavy meal alone. If you regularly wake up hungry with a headache, a small, balanced evening snack may be worth testing, but it's individual. If you have diabetes or take glucose-lowering medications, changes should be discussed with your clinician. The goal is stability overnight, not eating more across the board. Moving to slide 10. Now, let's connect the dots with migraine and tension-type headaches, because morning timing doesn't rule them out. Migraines can strike in the early morning due to natural shifts in hormones, sleep stages, and stress chemicals like cortisol. If your morning headache comes with light sensitivity, nausea, or one-sided throbbing, migraine is a possibility. Tension-type headaches tend to feel like steady pressure on both sides, often linked with neck and scalp muscle tenderness. What may help is identifying your pattern and triggers. For migraine, consistent sleep, hydration, and regular meals can reduce vulnerability. For tension type, posture during the day, screen habits, and stress load often matter as much as the pillow. If headaches are frequent, keeping a simple log, wake time, sleep quality, alcohol, caffeine, and symptoms can make the pattern obvious. And if you have new or changing headaches, that's a reason to seek medical guidance. Moving to slide 11. Let's get very practical. A simple 2-week morning headache experiment can tell you more than random fixes. Pick 2 or 3 variables only. For example, hydrate earlier in the day, set a caffeine cutoff, and adjust pillow height or sleep position. Keep everything else as steady as possible. Each morning, rate the headache from 0 to 10. Note where it hurts and how long it lasts. Also write down snoring reports, alcohol, and whether you woke with dry mouth or jaw soreness. After 2 weeks, you're looking for correlations, not perfection. Maybe headaches only happen after late caffeine, or only after alcohol, or they improve when you sleep on your side. This approach reduces guesswork and helps you talk to a clinician with clear data if you need to. Small, structured tests are often the fastest path to relief. Moving to slide 12. Finally, let's cover when a morning headache should be checked sooner rather than later. Red flags include a sudden, severe worst headache, headaches with weakness, confusion, fainting, or vision changes, and headaches after a head injury. Also pay attention if you're waking up with headaches more and more often, if they're consistently waking you from sleep, or if you have new headaches after age 50. If you suspect sleep apnea, loud snoring, choking, or gasping, daytime sleepiness, that's another strong reason to get evaluated. For most people, the cause is something manageable, like sleep quality, hydration, caffeine, or muscle tension. But it's smart to respect the warning signs. If you want to keep exploring this topic, make one change tonight that fits your pattern, then track it in the morning. One question for you. Do your morning headaches feel more like pressure or more like throbbing? Share your experience in the comments. And if you want more clear, practical health explanations like this, subscribe. This information is not a substitute for medical advice.